In Niagara, we are seeing fewer than 10 new COVID cases daily. Our active case count is currently hovering around 50. Good numbers, but the Delta variant means there is still some work to do. Dr. Mustafa Hirji joins us. Dr. Hirji, the focus right now is on convincing the unvaccinated to take the step to get their shots.
I think there's two groups there. We have actually a group who's gotten their first dose, and they're booked for a second dose sometimes in August, September, October. And we actually have lots of capacity now. We're not filling our clinics, so there's lots of room for people to come up and get that vaccine, either through us, through Niagara Health Clinic, pharmacies, primary care, whoever, and get those second doses earlier. The other part is that we need to get the first dose a little bit higher. And so what we're really targeting is a group of people out there that the polls show are actually in favor of being vaccinated, but haven't yet gotten vaccinated, and trying to make it really easy for them. So they don't need to go through the hassle of booking an appointment or traveling to a clinic. We want to try and have locations where they can get their vaccine right where they're actually going to be.
We're starting to see some concern out in the Calgary area where the Delta variant is starting to take hold. The United States as well is starting to worry about numbers coming back up. Do we think that that's going to happen here in Ontario?
I think the risk is certainly here in Ontario. You know, when you mention Alberta, you mention the US, a big difference between them and what we have in Ontario is in Ontario, we haven't completely opened up and dropped all of our COVID precautions. We're still wearing masks. We're still trying to practice physical distancing. There's still some requirements for our businesses to practice safety measures to make sure we stay safe from COVID-19. And I'm hopeful that if we maintain those, we won't see those kinds of surges, and we'll have enough time to keep vaccinating people until we get to a point that vaccines are high enough that we can actually drop those measures. But if we do it too early, I think we could go down the route of Alberta or the US.
You're encouraging people, everyday residents here in Niagara, to encourage others to make sure they get that second or even that first vaccination. How do you suggest they do that?
One of the advice put out by the Public Health Agency of Canada is that when you're having a family gathering, a social gathering where you're not going to have people, trying to stay 2 meters apart and wearing masks, you want to try and limit that to people who are fully vaccinated. So that might be one opportunity, that you're going to have some kind of social event and make a suggestion that people should only come if they're fully vaccinated, and that might be a way to give people a nudge without having that conversation. I think as well, if you're talking with a trusted group of people in your social circle, just striking up the conversation, letting them know that you got your vaccine, asking, have you got your vaccine? Where did you go for it? And if they haven't got it yet, they have some concerns, maybe your own personal experiences can help them move past that. If they're worried about side effects, you can talk about what you actually experienced. And hearing from someone they trust in their life might be the difference between them not being sure and actually going ahead and getting vaccinated.
Doctor, we're midway through the summer, which means back to school is just around the corner. I know Brock University and Niagara College are not demanding that everybody be vaccinated, but if they're in residence, those students need to be vaccinated. Are you worried about back to school, especially for elementary schools and secondary schools?
Yeah, and I think particularly when you talk about elementary schools, of course, those are children who are largely under the age of 12 who can't be vaccinated. And I am concerned that schools are going to be the area where we see a lot of outbreaks because there's going to be a concentration of people who don't have vaccine there. We just actually launched a campaign this week, Vax to School, just like back to school, but you want to make sure you get your vaccine before you go to school. And really, this week is a critical week, that if you get vaccinated within the next week, you'll have enough time to then get that second dose 3 weeks later and have 2 weeks so that you have full immunity by the time school starts. And I think that would be a really good thing everybody can do to make sure they're fully protected before they get back to school.
And those vaccinations can be done by walk-ins now all through Niagara, correct?
Yeah, absolutely. Public health, all of our clinics will accept walk-ins. Niagara Health at the Seymour Hanna Arena in St. Catharines, they're accepting walk-ins all day long as well. And many pharmacies are also taking walk-ins. So, find out what's the most convenient location for you and just show up and you should be able to get your vaccine.
Doctor, you had a chance to walk Anita Anand, the federal procurement minister, through the Seymour Hanna complex. What was her take on what was happening there that day?
I thought it went well. I think she's worked very hard to procure the vaccines for Canada, and I think she wanted to see how it is played out on the ground and that the vaccines are being used. She was actually quite interested that when we were touring the pharmacy area and they're drawing up the vaccines and getting in syringes, she had a lot of questions around that because I think she's very interested in actually procuring the vaccines and the syringes and everything. I think she was overall pretty happy and pleased with how things were working, and I think we are as well. We just need to keep up the work to make sure we get those vaccine numbers a bit higher.